Now, long-term exposure to air pollution is linked to increased risks of depression and anxiety in older adults. That's according to new research. Let's head immediately to Dublin, Ireland, to speak to Professor Anne Nolan from the Economic and Social Research Institute. Professor Nolan co-authored the study. Welcome to the programme. Tell us a little bit more.
Good morning. Yes, so the study we conducted looked at the relationship between a particular form of air pollution, which is particulate matter 2.5, and mental health and well-being in older people. So what we did was we linked data from the Irish Longitudinal Study on Ageing, which is a big national study of people over the age of 50 in Ireland, and we linked that to data on air pollution in the local area in which they were living. And we found that people that were living in areas that had higher levels of this form of air pollution were more likely to suffer from both depression and also more likely to suffer from anxiety.
Do you know why?
So there's a number of potential reasons why this might be the case. So if you think about air pollution, and you think about this particular form of air pollution, which are these really tiny, fine particles, we often think about the physical effects. So we think about poor air quality, we think about our lungs, and we think about effects on our respiratory system. But because these particles are so tiny, they penetrate really deep into the lungs, they can even cross the blood barrier. So we think that the mechanisms or the pathways through which that affects mental health are, number one, that it can lead to inflammation, and we know that inflammation in the body more generally is very bad for our health. It can lead to things like chronic stress exposure, but it can also affect the brain and cognitive function. And we think they're the potential pathways that lead or that are linked between this form of air pollution and poor mental health.
And you've been talking about a very specific type of air pollution. Would your guess be that it would extend to other types of pollution, or is there something unique to this type of pollution that might be causing it?
I think we'd need to do more research to try and understand that. But generally, I think those three pathways that I talked about, I think they would apply to other forms of small particles. I suppose it's worth saying as well that if you look internationally, Ireland has relatively low levels of this form of air pollution and air pollution in general. And I suppose what's interesting about this study is that it shows that even at very low levels of air pollution, there can be detrimental effects on health. If you compare our levels of air pollution with even other countries in Europe, but even more globally, we're among the lowest. So I suppose this really highlights the importance of, policy measures and efforts to reduce emissions and to reduce our levels of air pollution, and hopefully to see benefits in terms of people's health.
Yeah, I was going to ask about that, the sorts of possible solutions. Presumably they wouldn't be easy to put into place.
Yeah, so I suppose the main source of this form of air pollution in Ireland is burning of solid fuels. So things like coal and peat and wood for heating, just due to the climatic conditions. In other countries, it can be due to industrial sources as well. There's also a little bit that comes from traffic. And I suppose so in the Irish context, the solutions that have been tried to put in place are to first of all to burn or to ban the burning of smoky coal. So we've had successive, extensions of a smoky coal ban in Ireland over the last few decades. And we now have a nationwide ban on the burning of smoky coal and wet wood. And that came into place at the end of 2022. So it's a little bit early, I suppose, to see the effects of that coming through. We haven't got the data on air pollution for 2023 yet, but we're hoping to see reductions in air pollution. And then in subsequent years, you'll see beneficial effects on health. Right. But I suppose there are measures not just in relation to solid fuel use, but also more generally, as I mentioned,
Anne Nolan,
in terms of
thank you.